Communication Disorders Disrupt Effective Verbal and Nonverbal Communication, covering diverse conditions in DSM-5 TR. 1. Language disorder. Language disorder involves persistent difficulties in acquiring and using language, encompassing issues with vocabulary, sentence structure, and discourse. DSM-5 criteria: difficulties in language acquisition and use, including reduced vocabulary, limited sentence structure, and impairments in discourse. Exclusions: language deficits should not be due to sensory or motor impairments, another medical condition, or environmental factors. 2. Speech sound disorder. Speech sound disorder entails persistent difficulties in producing speech sounds, leading to distortions, substitutions, or omissions affecting speech intelligibility or clarity. DSM-5 criteria: persistent difficulty in producing speech sounds that impact intelligibility or clarity. Speech sound errors are not attributable to sensory or motor impairments, another medical condition, or dialectal, cultural, or linguistic differences. Exclusions: speech sound errors should not be attributable to sensory or motor impairments, another medical condition, or dialectal, cultural, or linguistic differences. 3. Childhood onset fluency disorder stuttering. This disorder involves frequent and marked disruptions in the fluency and flow of speech, including repetitions, prolongations, blocks, interjections, or revisions. DSM-5 criteria: frequent and marked disruptions in the fluency and flow of speech. Speech disfluency causes anxiety, avoidance, or limitations in communication, social participation, or academic or occupational performance. 4. Social pragmatic communication disorder. Social communication disorder pertains to persistent difficulties in the social use of verbal and nonverbal communication, such as deficits in understanding social rules, adapting communication to different contexts, and engaging in effective conversation. DSM-5 criteria: persistent difficulty in the social use of verbal and nonverbal communication. Communication deficits are not attributable to another medical condition or neurodevelopmental disorder. Exclusions: communication deficits should not be due to another medical condition or neurodevelopmental disorder. Additional DSM-5 categories. 5. Other specified communication disorder. This is used when the clinician can specify reasons for not meeting communication disorder criteria, for example, mixed receptive expressive language disorder in remission. 6. Unspecified communication disorder. This category is applied when the clinician chooses not to specify the reason that the criteria for a communication disorder are not met, for example, insufficient information or a need for consultation. Diagnosing communication disorders requires professional assessment, considering development and culture. Early intervention, speech therapy, and family support are essential for addressing challenges in education, employment, health, and social relationships.